My name is Lilia Kirkwood, and my research included the effect of workplace violence on the emotional stress and burnout of hospital nurses. Between 8 and 38% of nurses suffer from healthcare violence at some point in their career, according to the World Health Organization. Are hospital nurses who experience workplace violence, compared with those who do not, at a higher risk for emotional stress and burnout over time? As you can see in Figure 1 through the U.S. Bureau of Labor Statistics, workplace violence in hospitals is growing to be a serious concern. Frequent acts of violence against nurses can have a significant impact on their morale and ultimately lead many nurses to experience burnout. My methods for this research included searching online medical databases and finding the incidence of workplace violence specifically related to the emotional stress and burnout of hospital nurses. Inclusion criteria for articles were in the English language, peer-reviewed, and published between 2018 and 2023. Research articles were identified by searching the databases, including PubMed and CINAHL. Keywords used were workplace violence, nurses, and burnout. For my literature results, Kim et al. In 2020 did a cross-sectional data analysis, and that was used to find a correlation between workplace violence and emotional exhaustion. All types of workplace violence were shown to be positively correlated with emotional exhaustion. Havie et al. In 2020 did a survey where data was analyzed using moderated mediation regressions to explore the relationship between workplace violence against nurses and the various health outcomes. Workplace violence was more strongly related to burnout, injuries, and mental health issues. Biddy et al. In 2018 did an explanatory study, and it was used to interview nurses and nurse educators about their neurobiological response when experiencing workplace violence. Emotional and survival parts of the brain uptook decision-making and the emotional and behavioral regulation. Rosenthal et al. In 2018 did a cross-sectional data analysis, and that was used to assess the incidence of violence against nurses through an online survey. Many affected nurses recorded missing work and considered leaving their career because of both verbal and physical violence. Copeland et al. In 2018 did a cross-sectional design, and it was used to survey all emergency department nursing staff regarding levels of burnout. Exposure to violence of any kind led to higher levels of burnout and lower levels of compassion satisfaction. In Figure 2 from Havie et al. In 2020, the moderating effect of work environment conditions showed the positive relationship between workplace violence and emotional exhaustion. In Figure 2, Rosenthal et al. In 2018, 60% of respondents had at least one post-traumatic stress incident throughout their work. Discussing these studies, you can see how it directly reported the significant amount of workplace violence on the burnout and the emotional distress of nurses. While reviewing these studies, increased threat to physical safety in the current healthcare workplace have inherently increased feelings of uncertainty and nervousness. Nurses' experience of workplace violence has negatively affected nurses' emotional exhaustion and viewpoints of patient safety. When nurses view a threat to their safety and survival, decision-making ability is impaired because of emotional and physical impacts of violence. Exposure to violence of any kind in these studies led to higher levels of burnout amongst nurses. The limitations of the study include underreporting of workplace violence because it underestimates the severity of the problem and provides limited information to studies trying to uncover trends and attempting to reduce the occurrence of workplace violence. For nursing practice influence, training and education programs could be proven to be crucial to explore the establishing behaviors to expect while interacting with patients, give adequate support to many nurses, and give strategies on how to deal with various violent situations. Also, I believe a reporting policy could leave a system in place where hospitals can keep track of violent incidents, which would include follow-ups, recognizing trends, adjusting policies with developing data, and reducing the stigma. Overall, workplace violence is a conversation that is necessary in nursing, and it's not expected or acceptable in the workplace. No nurse should fear going to work. Therefore, the effect of workplace violence, the emotional stress of burnout of hospital nurses, is a crucial study that I was very interested to research.